Hi, students. Good evening. Sorry for that little bit delay that we had due to some technical glitch. So welcome back to this first professional exam made series, which is specifically designed to help you out for writing the first MBBS exams, which are upcoming in the month of August and September. In our previous episode last week, we had discussed about the most frequently asked topics for the head and neck region. And as per plan, today we will be discussing about some of the most frequently asked topics in the region of the brain, that is the neuroanatomy. So let's get started without wasting much time regarding the most frequently asked topics in neuroanatomy and what should be your approach when you're attempting to solve the questions related to neuroanatomy. First, let's talk about, just give me a minute. What we'll do first is we'll start with the most frequently asked topics in the chapter of spinal cord. And from there, we will take up through the topics of the brainstem. Then we will discuss about the topics which are related to the cerebrum, cerebellum, and then the encephalon, basal ganglia, blood supply, CSF flow, everything. Right? So what important topics that we must know in spinal cord? One of the common mistake that is done as a first year student by most of us, even I did the same, is to ignore neuroanatomy, thinking that neuro questions would come for what? 10 marks, 8 marks, 12 marks. So if I skip neuro topics, I can cover it up in other topics. Most often we don't realize that if we have not read neuroanatomy, we are completely losing out on those 10 marks and we are not even attempting it. Not attempting a question in your exam is equal to a crime, right? You cannot skip a question. So it's better to be prepared with the topics of neuroanatomy. You can prepare for these most frequently asked topics and go ahead with your exam. I'm sure that you will score as much as you can from these topics that we will discuss today. So what are the topics that we need to know in the anatomy of spinal cord? In the anatomy of spinal cord, you often get 3-marker questions, right? So 3-marker questions are the reasoning type of questions, right? On the anatomical basis for lumbar puncture. Where do we do lumbar puncture in case of children? Where do we do lumbar puncture in case of adults, right? In case of children, we do it between the intervertebral disc of L4 and L5. In adults, we do it between the intervertebral disc of L3 and L4. Why do we do it? The anatomical basis behind this is what is frequently asked in exam. This is because the conus medullaris or the lower end of the spinal cord lies at the level of the L1 vertebra, right? So this is one of the most frequently asked 3-marker question, right? Then along with this anatomical basis for lumbar puncture, they can also ask you regarding what are the structures pierced, right? The structures that are pierced during lumbar puncture, starting from the skin, the superficial fascia, the supraspinous ligament, the ligamentum flavum, the dura mater, arachnoid mater. So you should be able to list the structures pierced during the lumbar puncture in order. Done? So this is the first and the most important thing in spinal cord. Apart from this, you will get a lot of questions on modifications of spinal pia mater. Even the spinal cord is covered by all three meninges, dura mater, arachnoid mater, and pia mater. But modifications of the pia mater in the spinal cord is very frequently asked 3-marker or even 5-marker. Okay, so this could be an important 3-marker or a 5-marker. Now, what are the things that you must know here? Remember, the spinal pia mater, as we know, is modified into what? The filum terminale, right? That is the first modification. And then the next second modification is the ligamentum denticulatum. Then we have the linea splendens and subarachnoid septum. Done. So these are the modifications. Out of this, what is asked often in exam is regarding the anatomy of the filum terminale and ligamentum denticulatum. What is filum terminale? What is its length? What are the two parts? And then what is ligamentum denticulatum? How many ligamentum denticulatum is present? What is the function of ligamentum denticulatum? And what is the clinical importance? This is what we need to know. So whenever, let's say, phylum terminal is asked, how will you answer it? So first, begin with, let's say, the definition, then its length, and then possibly its parts. Whereas in case of ligamentum denticulatum, what you will do is you will define it, mention about the number, then its function, and then the clinical importance. This structuring of your answer, even if you are writing a 3-mark question, is very important, right? Rather than writing the anatomy of pia mater in paragraphs, imagine if you can write it under different subheadings. It makes it easier for the examiner to evaluate your paper, right? Make the job of the examiner easier during evaluation and you will get the maximum marks. Okay. This is the second topic that you must not miss in the anatomy of the spinal cord, the modifications of spinal pia mater, right? Then the third important question here in this topic of spinal cord is cauda equina. Now, what is cauda equina, right? What is cauda equina? It is the tough spinal nerves arising from the lower part of the spinal cord, right? Now, what you write after this is how exactly the cauda equina is formed. We know that cauda equina is formed by the lower 10 spinal nerve roots starting from L2 to the coccygeal nerve, right? So how the cauda equina is formed. Then why the cauda equina is formed, right? Reason for formation. This is because the spinal cord ends at the level of L1, but the spinal nerve roots can emerge only through their respective intervertebral foramen. In order to emerge through the respective intervertebral foramen, the lower spinal root starting from L2 will take more vertical course before they exit out of the respective intervertebral foramen. This leads to formation of cauda equina, right? Then you can add a little bit about the clinical importance of cauda equina. What do we mean by the cauda equina syndrome? What happens when these lower nerve roots get compressed? Again, as I said, trying to list or explain cauda equina under the headings. This is what is important. Okay. Most often, all we remember about cauda equina is it is looking like the tail of a horse, right? And it refers to the lower spinal nerve roots. But what nerve roots are formed, why it is formed, and what will happen if it is compressed is what the evaluator will expect, right? Then what about the transverse section of the spinal cord at mid-thoracic level? Now, here, I want you to highlight this. Most often, you will be asked about draw a neat label diagram of transverse section of the spinal cord at the level of the mid-thoracic region or above T6 or below T6. Now, where the examiner is asking you to write the diagram is very important. Just let's try to understand why this is so. Now, if the question is on the diagram of transverse section of spinal cord at mid-thoracic level, how will we do it, right? So let's just try to draw it. Okay. So let's imagine we have the spinal cord transverse section, which will look like this. Now, since we are talking about the thoracic level, mid-thoracic level, remember the gray matter will be narrow, right? So narrow posterior horn, there will be a lateral horn, and there will be a narrow anterior horn. There will be gray commissure. So let's imagine this is the posterior horn, this is the lateral horn, gray commissure, and this is the anterior horn. The most conspicuous feature the examiner will always look is for the presence of lateral horns, right? Because lateral horns are present from the T1 to L2 level, the thoracolumbar level, and lower down in the sacral region. What is the function of this lateral horn? This gives rise to the autonomic neurons, right? So when they ask about the thoracic region of spinal cord, this is the first thing that they will look for. They will not look for anything else. After this, they will look for the positioning of the nerve tracts. And two of the most important nerve tracts that they will often look is the dorsal column and its two nerve tracts. Now, when we write the dorsal column, we know that the dorsal column is divided into a medial part and a lateral part, Now, what is this medial part and lateral part? So we have what? Fasciculus gracilis. We have fasciculus cuneatus. Now, the question is, would you write the fasciculus gracilis if they ask you to write the section of the spinal cord, let's say at the level of T7 or T8, any level below T6? Remember, the fasciculus gracilis is present throughout the spinal cord, right? Starting from the coccygeal region till we go to the sacral region. But remember the fasciculus cuneatus, right? Which carries the conscious proprioception, discriminative touch, pressure, and vibration, begins only after the T6 level. That is, it tends to carry these sensations from the upper part of the body, including the upper limbs. So, if you are writing the transverse section of the spinal cord below the level of the T6, you must never show the fasciculus cuneatus. And this is what the examiner will look for, right? Apart from this, he will look whether you have written one of the most important descending tract of the spinal cord. And what is it? The corticospinal tract, lateral corticospinal tract, right? Then what about some of the important ascending tracts you must write? The ascending tracts, let's say, here we have the posterior spinocerebellar, here we have the anterior spinocerebellar, the lateral spinothalamic tract, the ventral spinothalamic tract, right? So these are some of the major nerve tracts that they look for. If you miss, let's say, some of the extrapyramidal tracts like reticulospinal, vestibulospinal, or tectospinal, that is still fine. But you must never miss the dorsal column pathway. You must never miss the pyramidal tract, and you must never miss the spinothalamic tract as well as the spinocerebellar tracts. This is the trick to impress your examiner with your answer, right? These are the major things that the examiner would look for in the diagram, and you need to highlight it. So whenever you do it, possibly highlight that tract so that the examiner actually sees it. Done? This is how you will draw the diagram, right? And remember again, none of us paper evaluators would expect each one of the students to write an artistic diagram. Not everybody can do it, right? If it's your strength, do it. But if you are not very good at drawing diagram, even if it is anatomically correct with respect to its position, that's all that we look for. Fine. So please don't hesitate to draw a diagram if you're bad at it. Okay. Draw it correctly. Okay. There is no need to draw artistic diagrams in exams. Right. Then coming back to the topics asked in the spinal cord, the next important thing is about the nerve tracts. Right. Very often this is felt as a difficult topic by most of the students. But remember, in your physiology exam, possibly the nerve tracts would be a very important long essay for all of you. Right. Now, what should we know in the anatomy of the nerve tracts? Remember, in the anatomy of the nerve tracts, the first thing that we should know is the classification. Classification of the nerve tracts as the descending tract and the ascending tracts. Okay. Then in the descending tracts, learn about the pyramidal tract thoroughly. In the ascending tracts, learn about the dorsal column, then the lateral spinothalamic tract, the ventral spinothalamic tract, and possibly a little bit about the spinocerebellar tracts. But remember, the dorsal column pathway, the spinothalamic tracts, and corticospinal tract. These are the three tracts that are very often asked in the exam. Even learning these tracts is very easy if you remember the concept of the upper motor neuron and lower motor neuron for the descending tract, and the concept of the first order, second order, and third order neuron for the ascending tracts. Let me give you an example. Okay, let's think we are talking about the corticospinal tract. What to write? Okay, so corticospinal tract, let's say, will begin with the cerebral cortex. So let's imagine we have the right and left cerebral cortex. Okay, then let's imagine we have the sections of the brainstem, right? Even if you cannot draw the shape, just write at least a Venn diagram for, let's say, the midbrain, then the pons, and then let's say the medulla oblongata. And anyhow, we can draw the diagram of the spinal cord, the gray matter, right? The posterior horn, the anterior horn, the posterior spinal nerve or spinal nerve root. This is the ventral root of the spinal nerve. Okay. Now, in case of a pyramidal tract or a motor tract, we have an upper motor neuron which begins from the primary motor area, descends first through the corona radiata. Okay. So descends first through corona radiata, and then it passes through what? The internal capsule, right? So you can show like this, and through this it descends onto the midbrain. Then it further descends onto the pons. Then it descends onto the medulla, where it crosses to the opposite side, forming the lateral corticospinal tract. And here we have the formation of the lateral corticospinal tract. Okay. This further descends down into the spinal cord, and from the anterior gray horn, we have the beginning of the lower motor neurons, which will supply the target organs. This is in simple your corticospinal tract. So you should remember where the upper motor neurons begin, where they end, where the lower motor neurons begin, where they end, and where is this crossing over is occurring. Right? Similarly, if you are drawing about the spinothalamic tracts or dorsal column pathway, again, for dorsal column pathway or the spinothalamic tract, how we remember it. Okay. So let's try to draw one more diagram to understand the anatomy of the ascending tracts. Okay. So again, let's think we have the cerebellar cortex, right? Again, we have what? The midbrain, the pons, the medulla oblongata, and let's imagine we have the spinal cord, right? The gray horn, right? So we have the dorsal nerve root, we have the ventral nerve root. Done. Now imagine there is skin and somebody touches the skin, the receptors get stimulated. How this sensation is carried to the brain? So the neurons basically begin with the receptors here. So we have the first order neurons which are located in the dorsal root ganglion. We are talking about, let's say, the dorsal column pathway, right? So the first order neurons have their dendrites which begin from the receptors, right? And end in the cell body. From here, we have the axon which reaches the dorsal column, right? Ascends through the dorsal column, then the medulla oblongata. Here, it ends in a nucleus. Let's imagine the sensations are coming from the upper limb. So we will call it as what? Nucleus cuneatus. So the fibers end in nucleus cuneatus. These are the first order neurons. The second order neurons begin from the nucleus cuneatus. They pass on to the opposite side, forming what? The internal arcuate fibers, right? Then they ascend upwards. As they ascend upwards through the pons and midbrain, we now refer it to as what? The medial lemniscus, right? Then the important thing about all sensory tracts is they relay in a nucleus. Okay. Now a nuclear mass called as thalamus, right? So this is where this second order neurons end. So these are what? These are second order neurons. Done? I'm sorry. Now from this second order neurons, we have the beginning of the third order neurons. So let's imagine the third order neurons begin here and they reach the primary sensory area, primary somatosensory cortex, which is area number 312. And this is the third order neuron. All ascending tracts, except for your olfactory pathway, will have these three orders of neurons. So you must know where the first order neurons begin, where do they end. Second order neurons, where do they begin, where do they end, and where is this crossing over of fibers occurring? Is it occurring at the level of the spinal cord itself, or further higher at the level of medulla, or even further higher? But remember, all sensory tracts that we write, spinothalamic tract, let it be anterior, or lateral spinothalamic tract, these sensory tracts always go to the thalamus before they terminate in the somatosensory area. Remember, the only sensation that never goes to thalamus is the olfaction. So this is how you must approach the nerve tracts. Fine. Once you have this concept, it becomes a lot more easier. Right? Done. Now, the other important question we must know in the anatomy of the spinal cord is regarding its blood supply. How anterior and posterior spinal arteries supply arterial blood to the spinal cord. This is a must. Fine. You must know the arterial supply of the spinal cord. Then, Brown-Sequard syndrome is often asked as a 3-marker, but more than 3-marker, we expect it to come as MCQ, right? Even the site of lumbar puncture, right? This could be an important MCQ for you, right? Where does spinal cord end? That is an important MCQ. The spinal pia mater, where does it end? So let's write it here. The spinal meninges, right? And spinal cord. So we must know for both the vertebral levels, right? So important thing that we must know regarding vertebral levels is spinal cord begins at the level of C1 vertebra, right? So what passes through foramen magnum is medulla oblongata. Below the level of upper border of the C1 or the atlas, we call it as spinal cord. Then spinal cord ends at L1. Spinal dura mater ends at the level of S2. Spinal arachnoid mater ends at the level of S2. Spinal pia mater ends at the level of tip of the coccyx. So these are must-know vertebral landmarks for the spinal cord and its coverings. So these are some of the important topics that we must know in the anatomy of the spinal cord. As I said, if you skip these topics, then it would become difficult for you to score and manage, right? So please focus on these topics from the chapter of spinal cord. Similar to this, let's say we are talking about the brainstem. As I said, we started with the spinal cord. Now we are going towards the brainstem. If the preparation is about the chapter of the brainstem, the first thing you must learn thoroughly is the external features. What are the external features of the brainstem on its ventral surface and dorsal surface? More often than the ventral surface, what they usually ask about is the dorsal surface of the brainstem. Because the dorsal surface of the brainstem has the rhomboid fossa, which is commonly referred to as the floor of the fourth ventricle. Okay. Now, this is a very important short essay, right? Very important 5-marker for your university exam. Fine. And you must practice the diagram for floor of the fourth ventricle thoroughly, right? Now, when you see it in the textbook, it again looks very scary, right? The diagram of floor of the fourth ventricle. So let's see if we can make it a little bit simpler, right? As we said, it appears like a rhomboid fossa. So let's imagine. So we can write first, let's say we have the superior cerebellar peduncle. Let's say here we have the inferior cerebellar peduncle, right? And in this region, we have the middle cerebellar peduncle. Done. So here we have the part of the medulla oblongata, right? So this is the posteromedian sulcus, let's imagine, right? Now, what are the important features we need to know in the floor of the fourth ventricle? The first thing we need to draw is the median sulcus, okay? The median sulcus on either side is limited by a groove called as sulcus limitans. Okay. So lateral to the sulcus limitans, the area we have is called as the vestibular area, right? So this groove is called as sulcus limitans, right? And then this is the median sulcus, right? What are the important areas that the examiner will look for? In the lower part of the pons, right? Remember, we have two elevations like this. So remember, this part of the brainstem is formed by the pons and the lower part by medulla oblongata. Medulla oblongata has two parts. This is called as the open part. This is called as the closed part, right? So these are the features we need to show. So what we are showing, the facial colliculus, right? So we show facial colliculus. Then as we come down, what are the important areas we must show, right? Below the facial colliculus, we have a triangular area, right? This triangular area is called as the hypoglossal triangle, right? Then below this, there is one more triangular area. This is called as the vagal triangle. And here we have a region called as area postrema. So these three are a must. You must show this, right? And then you must show this facial colliculus, right? And then here closely, we have the superior fovea, right? And locus coeruleus. This is as simple as the diagram of the floor of the fourth ventricle. Again, as I said, you need not be artistic, but you should be quick, you should be correct, right? That's all that's required for your exam and the diagrams, right? So the first question, as I said, you need to know in brainstem is from the dorsal surface of the brainstem, where you need to know the floor of the fourth ventricle, anatomy of floor of the fourth ventricle. Then in the entire chapter of brainstem, what they will ask you is they can ask about any of the 7 diagrams related to the transverse sections, right? Vishram Singh would be the best book to go through these diagrams. The Clinical Neuroanatomy by Vishram Singh has wonderful images which are very easy to draw, very easy to correlate, right? What are the diagrams we must learn? The first diagram is the transverse section of the medulla oblongata at pyramidal decussation. When the question is at pyramidal decussation, the most important event that you need to show at this level is the pyramidal decussation, right? This is what the examiner will look for. Even if you have written all the cranial nuclei present here, and if you have not written pyramidal decussation, you will lose the marks, right? Then you need to draw the section at the level of sensory decussation. This is where the dorsal column fibers, the first order neurons end, they cross to the opposite side and they become the internal arcuate fibers and the medial lemniscus, right? So that is the most important change, right? At the level of olives. The most often asked question in this transfer section is this, the level at the pyramidal decussation, transfer section of medulla at pyramidal decussation. Remember, when you are preparing for brainstem, again, you cannot choose. Okay, the pyramidal decussation has been asked very frequently. I will read only this. I will practice only this. Now, this would be very dangerous. Okay, you have 7 diagrams to learn, right? And believe me, one of these 7 diagrams are often asked every year. Okay, so this is one topic in the neuroanatomy where you can bet on, right? 7 diagrams, if you're thorough, 5 marks are in your pocket. Okay, because these are the 7 diagrams that are very often asked, right? Then what about pons? Now at the level of pons, again, there are 2 diagrams, one at the level of upper pons and one at the level of lower pons. The section at the lower pons is also called as the section at the facial colliculus. Okay, it is also called as the section at facial colliculus, and this could be a very important question again. Done? Right. Now, apart from this, what other questions can come? The transverse section of the midbrain at the level of superior and inferior colliculi. Right? In the midbrain, of course, 2 colliculi located in the posterior part of the midbrain, superior and inferior. If you know the section images at these 2, it is enough. Now, if you can't remember everything that is shown in these sections, what is that one thing that the examiner would often look for? Remember, one thing, the most important event that occurs at that particular section. For example, medulla pyramidal decussation, you need to show the decussation of corticospinal tract. Sensory decussation, you need to show the crossing of internal arcuate fibers. At the level of the olives, you need to show the olivary nucleus and then the cranial nerve nuclei located in the medulla. So one important thing all of us should know in brainstem is the cranial nerve nuclei. Okay, right? in which part of the brainstem we have which cranial nerve nuclei. This is what we must know thoroughly. Done? Right? For example, you are drawing the transverse section of the midbrain at the level of superior colliculus. What will the examiner look for? The examiner will look for, of course, let's try to draw this outline of the section of the midbrain at the level of superior colliculus. Okay. So the superior colliculus has a dorsal part where we have two elevations. And then let's say this is how the ventral part will look. So this is the transverse section of the midbrain at the level of superior colliculus. So we need to know the superior colliculus in the dorsal part, right? The anterior part of the midbrain forms the cerebral peduncle, right? So we have the crus cerebri, and then we have the region of the substantia nigra, and here we have the region of the tegmentum of the midbrain. Here we have this is the periaqueductal gray matter. We have the cerebral aqueduct, and we have two important nuclei. One is the mesencephalic nucleus. Sorry. One is the mesencephalic nucleus, and the other one is the oculomotor nucleus, right? Then we need to show the emergence of the oculomotor nerve, right? So this is the crus cerebri. Fine. And this dark area we have, this is the substantia nigra. Done. So this is what we need to draw for the section of the midbrain. As I said, what the examiner will look for is, of course, whether you have written the ventral and dorsal part of the midbrain. Have you shown superior colliculus? Have you shown the cerebral aqueduct? Have you shown the mesencephalic nucleus, the oculomotor nucleus, the substantia nigra? Right. And then we have important nerve tracts. For example, we have the medial lemniscus, trigeminal lemniscus, and spinal lemniscus. Okay. If we are drawing the section of midbrain at the level of inferior colliculus, you can just open your book and check. You will have one more nerve tract, and that is the lateral lemniscus, right? Lateral lemniscus is associated with the hearing pathway, and it ends at the level of midbrain at the level of inferior colliculus. That is why we don't see it here. Done. So this is how your preparation should be. Fine. You cannot prepare for these diagrams blindly, right? You need to identify, you need to mark the most important events that occur at each of these diagrams, and then try to write it and then highlight it when you write the same diagram in exam. Done? Are we clear? Right. So this is regarding the topic of the brainstem, right? Start with the external features. In that, learn thoroughly the floor of the fourth ventricle, the diagram, and then 7 transverse section of brainstem, 3 of medulla, 2 of pons, and 2 of midbrain. Done? And try to remember in which part of the brainstem you have which cranial nerve nuclei, right? This could be important MCQ question. For example, where will you find abducens nerve nucleus? It is found in pons. Where do you find oculomotor nucleus? It's found in midbrain. Where do you find the hypoglossal nucleus? Where do you find the nucleus associated with the vestibular nerve or cochlear nerve, right? So this is how you can get questions. Done? So this is regarding the topic of the brainstem. Once we know the important topics that are asked in the chapter of brainstem, let's talk about one more very important subtopic in the neuroanatomy section, and that is the chapter of the cerebral hemisphere. Okay. Now in cerebral hemisphere, undoubtedly, you need to be prepared for the sulci and gyri. Okay. This will be a very important 10 marker. okay, or a long essay. So is your functional area, right? Sulci and gyri of the brain, especially the superolateral surface. Okay, so let's write it. Sulci and gyri present on the superolateral surface of the cerebral hemisphere. The functional areas present on the superolateral surface of the cerebral hemisphere, these two, let's agree that very important and most frequently asked long essay questions, right? You should be able to draw a simple diagram and show the sulci and gyri present in each of the lobes of the cerebral hemisphere, right? Similar to this, functional areas present in each of the cerebral hemisphere. For example, a simple diagram like this showing the superolateral surface, the occipital lobe, then the temporal lobe, right? The central sulcus, right? Then the subdivision into four lobes, right? So in the frontal lobe, the precentral sulcus, superior and inferior frontal sulcus. In the temporal, superior temporal, inferior temporal sulcus. Here, postcentral sulcus, the intraparietal, parieto-occipital, lunate, calcarine, right? So this is how you should simply draw the diagram and label it. Then within this, the functional areas. For example, area number 4, 6. Here, let's say area number 8. Then here, area number 44, 45, the Broca speech area. Here we have area number 22, auditory association area. Then 41, 42, 39, 40, 3, 1, 2, 17, 18, 19, right? So this should be at your fingertip, okay? And you need not wait and waste a lot of time drawing this, okay? A simple line diagram like this should be enough. If you are asked about functional areas, how do you write it, right? Now, let's imagine you want to explain the answer now. You have written the diagram and you want to explain, right? So let's say we start with functional areas present in frontal lobe. Present in the frontal lobe. Now, how we can write it, okay? So see if you can create a simple table, right? Now, what is the area that you want to describe? Okay, so let's say you want to talk about primary motor area. So what you can write about primary motor area is, what is the area number? What is the area number? It is area number 4. Where is it located? Right? Where is it located? It is located in precentral gyrus. Okay, then what is its function? When stimulated, it produces contraction of muscles of the opposite side. Muscles of opposite side. Then what will happen if this is injured? Right? Injury to this will produce contralateral hemiplegia. For each functional area that you describe, you must know what is the Brodmann's number, where exactly it is located, which gyrus it is represented by, what is its function, and what happens when this is injured. Imagine if you can summarize this in the form of a table. If you're not comfortable, then start like first talk about primary motor area. So write the heading. Then talk about the area number, right? Then you talk about the location regarding which gyrus. And then you talk about the function. And then you talk about the lesions, right? Anything is fine. Okay, you draw a table, you write like this, and completely left to you. But I would always prefer this over this. Okay, because it becomes very clear to the examiner that you have learned the concepts well, and on your own, you are able to summarize the answer in a tabular column, right? Which is one of the highest form of learning, right? So this is how you can actually impress the examiner. A diagram, a table with it, where you have explained everything in a nutshell, in a summary, which makes it easier for the examiner to read it. Done? Right. So this is one of the most important questions in neuroanatomy, which you should never skip. The functional areas and sulci and gyri of the brain. Then The next important topic here in this is the white matter of the cerebral hemisphere. In the white matter, we must know the classification for sure. Okay, so we must know classification. There are three types, right? Association fiber, commissural fiber, projection fiber. These three we must know. Okay, then in the white matter, please be prepared for a 10 marker or a long essay on internal capsule and a 5 marker or a 3 marker on the anatomy of corpus callosum. Remember, the internal capsule is a favorite topic of your paper setters. Let it be a theory exam. Even in entrance exam, we see a lot of questions on internal capsule, right? So you must learn. There is no other go, right? Internal capsule, corpus callosum, we must learn. One more thing about internal capsule, they often ask is its relation. Fine. Now, most of the diagrams given in a book could be sometimes confusing, right? Now, how do we draw the relations of the lateral ventricle? If you check the question papers, they ask about the relations of the different horns of the lateral ventricle. Okay, so let's imagine here we have a C-shaped lateral ventricle. Okay, this is a C-shaped lateral ventricle which has an anterior horn, then a body, then a posterior horn, right? And then an inferior horn, right? So this is how the lateral ventricle would look. Now, what are the relations that we need to remember? Okay, so let's try to identify the parts. This is the anterior horn. This is the trunk or the body. Here we have the inferior. This is the posterior horn, right? And let's say here we have the inferior horn. They will ask about the relations, right? So how do we remember the relations? Remember, the lateral ventricle is bounded by one important structure. And what is that? It is the corpus callosum, right? The corpus callosum has a peculiar relation with the internal capsule. It entirely covers the anterior horn, forming its anterior wall, roof, and floor. Then it covers the entire body of the lateral ventricle. Okay, where it passes posteriorly as the enlarged splenium, right? Now this splenium would form the roof, the lateral wall, as well as the floor of the posterior horn. So one of the most important relation of the lateral ventricle is the corpus callosum, right? Now, what we were discussing was regarding, let's say, the internal capsule. Now, why we suddenly shifted to lateral ventricle? Remember, when we take a section of cerebral hemisphere, we often see the C-shaped lateral ventricle, and one of the most important structure related to it is corpus callosum, right? So if you want to know corpus callosum, this diagram is a must. And then to describe lateral ventricle anatomy, this diagram is a must. Done? Apart from this, what are the other important relations of the lateral ventricle we need to show? Remember, we have something called as the caudate nucleus, which actually is a C-shaped nucleus, right? Which appears like this. So this is the caudate nucleus. Below the inferior horn, we have the hippocampus, right? Then collateral sulcus. Okay. Then one more structure we have as, let's say, the thalamus, right? Then we have the mammillary body here. And from the mammillary body, we have the stria terminalis, which goes to the septal area, right? This is the stria terminalis. So here we have learned a little bit about corpus callosum. Corpus callosum is a commissural fiber that is present in the brain, forms one of the most important relations of lateral ventricle. So what we tried here is to describe about the lateral ventricle as well as corpus callosum. Done? What about internal capsule? Internal capsule, what we need to know is, so let's talk about internal capsule. Now in internal capsule, what are the things that we need to know? What are the parts of the internal capsule? Remember, the internal capsule, let's say, will have an anterior limb, a genu, a posterior limb, then retrolentiform, sorry, this is the sublentiform part, and this is the retrolentiform part, right? Now, what are the parts of internal capsule and what are the fibers present in internal capsule is very important. In the beginning, it might sound very difficult to remember what are the fibers present in the internal capsule, but try to remember the genu will have corticonuclear fibers, right? Whereas the posterior limb will have corticospinal fibers. Then the retrolentiform part will have auditory radiations. This is the retrolentiform part. This is the sublentiform part. The retrolentiform part will have optic radiations. Even if you forget everything else, please try to remember these four types of fibers which are present in internal capsule. Okay. In the region of genu, we have the corticonuclear fibers, which will have the nerve fibers of the cranial nerves, right? So these fibers usually terminate in cranial nerve nuclei. The posterior limb is having corticospinal fibers of the pyramidal tract. And remember, this part of the internal capsule is supplied by the middle cerebral artery. Okay, and this is one more important question which could be asked as an MCQ question, right? Internal capsule, you can get a 10 marker question and you can get a lot of MCQs from this chapter. Done? So you must thoroughly know this, right? So in the topic of cerebrum, sulci gyri, functional areas, white matter, blood supply. In blood supply, the summary, which artery supplies the superolateral surface mainly? And what is that artery? Yes, it is the middle cerebral artery. Which artery supplies the medial surface? Which is it? It is the anterior cerebral. Which supplies the posterior part of the cerebral hemisphere and the posterior part of the medial surface? It is the artery of the vision or posterior cerebral, right? At least if you know this much, it is more than enough, right? So this is regarding the cerebrum. Once we have learnt about cerebrum, what are the topics to know in the chapter of cerebellum? In the chapter of cerebellum, we must thoroughly know about the anatomical subdivisions, right? In anatomical subdivisions, what we need to know is what are the subdivisions of the vermis, right? Remember, if you have seen the diagram, it looks like a tortoise, right? In the median region, we have the vermis, and on the two sides, we have the cerebellar hemisphere. So the parts of the vermis, like lingula, then we have the central lobule, culmen, then we have the dicli, folium vermis, tuber vermis, pyramid uvula, and correspondingly on the cerebral hemisphere, we have the quadrangular lobule, ala, superior semilunar lobule, inferior semilunar lobule. This is a must again, right? You must know the anatomical subdivisions of the cerebellum, right? Once you have learned this, morphological subdivisions of the cerebellum into the archicerebellum, paleocerebellum, and neocerebellum, right? What are the components of the vermis and the lateral lobes which form part of each of this morphological subdivision? This you must know. Then the deep cerebellar nuclei. What are the four deep cerebellar nuclei we have and what is its output? Remember, the deep cerebellar nuclei can be remembered by the mnemonic doctors eat good food, right? The dentate nucleus, right? Then emboliform nucleus, nucleus globosus, and nucleus fastigius, right? So these are the four nuclei they often ask, right? Then the cerebellar peduncles. In this, remember, the superior cerebellar peduncle and the inferior cerebellar peduncle is the one they often ask. In this, you must know what are the afferent fibers and what are the efferent fibers. Remember, the superior cerebellar peduncle will form the chief efferent pathway, right? This is the chief efferent pathway of the cerebellum, and this is the chief afferent pathway of the cerebellum. So what are the nerve fibers present in it? You must remember. Now, just to tell you in brief regarding the superior cerebellar peduncle, try to remember it as CCD, the fibers coming from or passing through the superior cerebellar peduncle, the most important of which are the dentato-thalamic and dentato-rubral. Similarly, for afferent pathway, we have the mnemonic POP, CAR. Right? So try to remember the fibers which are present in each of these cerebellar peduncles using these mnemonics. Done? Right. Cerebellum, the question that you can expect often is this. Cerebellar peduncles, you might get a lot of MCQs on what are the types of fibers present in the cerebellar peduncles. Done? Right. Then, in the ventricles, okay, each of the ventricle is an important phi marker, but every time this is the ventricle that is asked, okay, in the frequency, then this would be the next, the lateral ventricle. Especially in lateral ventricle, in the fourth ventricle, they usually ask about the floor, right? Then in the lateral ventricle, they very often ask about relations, especially of the anterior horn and the inferior horn, right? Highlight this and try to learn this thoroughly. The diagram that we learned in the chapter of the cerebrum, this is the diagram that will help you to remember the relations of the lateral ventricle. If you can practice this and draw this diagram, one single diagram, this is enough for the relations of the lateral ventricle. You need not practice multiple diagrams. This one diagram. Done? Right. So this is regarding the ventricles of the brain. Then the blood supply of the brain, of course, all of us know that we need to know about the circle of Willis. How exactly the circle of Willis is formed? Can we do it quickly? So the circle of Willis is formed by, let's imagine we have the internal carotid artery, right, on either side. The internal carotid artery will give off the anterior cerebral arteries, which are connected by the anterior communicating artery, right? Then we posteriorly have, let's take a different color. So posteriorly we have what? The vertebral artery uniting to form. Let's do it in a different color. So let's imagine we have the two vertebral arteries which will unite to form the basilar artery. The basilar artery will divide to form two posterior cerebral arteries, and then these are connected by, let's imagine, these are connected by the posterior communicating artery. So this is the circle of Willis, right? In the blood supply of the brain, this is one question which will be asked. You should know how to draw the diagram and label it. Then they can ask about the arterial supply of the cerebral hemisphere. As I said, which artery supplies the superolateral surface, which artery mainly supplies the medial surface, and which supplies the inferior surface of the brain. Done? So these are the possible questions that we get in the chapter of blood supply of the brain. Very rarely, you might get questions on venous drainage of the brain. And one more question that you can often expect in this chapter is the blood-brain barrier. Okay. Now, if blood-brain barrier is asked, remember, define what is it, then describe the formation, then function, and areas where it is deficient. Okay. I know I'm not telling you the answer, but what I'm giving you is the headings under which you must describe blood-brain barrier. Okay. So this could be one more important phi marker in the chapter of blood supply of the brain. Right? The blood-brain barrier. Then the next important topic you must know. I know that most of you will skip this, but for your physiology also, this will be important, right? In the topic of diencephalon, at least know about thalamic nuclei and focus only on the specific thalamic nuclei, okay? So what are the specific thalamic nuclei you would look for? Please try to learn about the ventral posteromedial, ventral posterolateral, ventral anterior, medial geniculate body, lateral geniculate body. For each of them, know where is the afferent fibers coming from, where is the efferent fiber going, and what is its function. If you can draw the simple table, this simple table is alone in the chapter of thalamus for anatomy at least, right? Diencephalon thalamus could be even a long essay for your physio neuro section, right? But for anatomy, if you know about these 5 nuclei, where the afferents come from, where the efferents go, and what is its function, this is all we need to know, right? Then hypothalamic connections. Even in hypothalamic connections, all we need to know is the nucleus and the function, right? Name of the nucleus and what function it does. And if you can draw the position of the nucleus in the sagittal section of the hypothalamus, nothing like it. Showing where exactly the preoptic nucleus lies, supraoptic nucleus lies, paraventricular, then mammillary nucleus, ventromedial, dorsomedial, anterior and posterior. If you can draw this and in the diagram, if you can show the function, nothing like it. Okay. So don't leave thalamus and hypothalamus. At least read about the 5 specific thalamic nuclei, at least 6 to 8 hypothalamic nuclei and its function. Then know a little bit about basal ganglia at least. Okay, in basal ganglia, just the components. Okay, so what are the components of basal ganglia that we must know? The basal ganglia is divided into, let's say, the caudate nucleus and let's say the lentiform nucleus. And the lentiform nucleus is further divided into putamen and the globus pallidus. The caudate nucleus and putamen put together is called as corpus striatum. At least this you must know. The subdivisions of the basal ganglia, and then what are the functions? What will happen if the basal ganglia are involved? We know that involvement of the basal ganglia leads to Parkinson's disease. At least this we must know, right? So this is regarding the diencephalon and the basal nuclei, right? Now, this is regarding the most important topics that are asked in the main topics of neuroanatomy. The last 2 topics that I want you to prepare for your university exam is, one is the chapter of or the topic of subarachnoid cisterns. Even in subarachnoid cisterns, all I want you to know is the name of the subarachnoid cistern, where exactly it is located, and what are the contents, right? For all the cistern, you can write blindly CSF. But apart from CSF, what we must know is what blood vessel, right? What blood vessel is present in each of the cistern. This is what we must know. Done? Then, what is the pathway of CSF circulation? How it is produced in the lateral ventricles and how it is finally absorbed by the arachnoid villi or arachnoid granulations in the superior sagittal sinus. You must be able to draw it in the form of a flow chart. If you can draw it using a diagram, nothing like it. But if you can draw a flow chart showing the outline of CSF flow, even that should be good enough. Done? These are the must-know topics in your neuroanatomy. Once you give your neuroanatomy paper, check the paper again because most of your questions, if not all, will be from these topics that we highlighted today. Okay, so spend some time at least for one day, right? In the entire study holidays you are doing, do neuroanatomy for one day and going through these topics alone, and try to revise this at least couple of times before you go for exams. I'm sure that if about 10 to 15 marks are allotted to your neuro topics, you will be able to score at least 10 out of them. Done? So this is regarding the important topics that we wanted to highlight in the section of neuroanatomy and what should be your approach. So we are done with the head and neck topics and neuro topics. As per plan, the next Monday, we will talk about the important topics from the section of thorax, right? And then again, we will continue further through rest of the topics of anatomy. If you want me to discuss any of the other important topics, please do let us know. We will discuss these exam important topics in detail, and we will also help you out in how to structure your answer to score maximum in your exam. This is regarding the most important questions that are asked in neuroanatomy. Thank you for all of you for joining this session, and all the best.